Okay, good morning, everyone. And thank you very much for all being here. And again, to the media, to the TV, radio, and print media, thank you very much for getting this important information out, if not daily, at our weekly press conferences pertaining to COVID-19. Before we start, I'd like to take a moment of silence for a dear family friend. She was the matriarch of the Forestieri Funeral Home family. Sylvia Forestieri had passed away just very recently, and she was just a wonderful person. And Forestieri's has always been there to care for many individuals and families during their trying times. So a moment of silence for the matriarch of the Forestieri Funeral Home family, Sylvia Forestieri. Thank you very much. I'd also like to wish everybody happy Kwanzaa, and I hope everybody had a great Christmas. I know we had to be much more low-key on it, and here is to a very hopeful, good riddance to 2020, and to a very hopeful, healthful, and successful new year of 2021. So happy New Year to each and every one of you. To give you a brief update, and I also want to thank our lovely young ladies of sign language. Lovely young ladies, again, for being here. Really appreciate that. Thank you very much. And I also want to thank Dr. Kerouac, the President and CEO of Bay State Health Systems, who is faithfully here. Dr. Roos, Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, unfortunately cannot be here. He has sent me a statement, which I will read at the appropriate time. Total confirmed cases since the start of this COVID-19 pandemic in the city of Springfield is 10,586. The weekly total last week was 866. You might not think that's not that bad, which it isn't, but you got to remember that due to the holiday situation, the Governor Baker stopped the spread, AMR, and Patrick Leonardo. I appreciate Director of Operations always being here. They did not test Wednesday, Thursday, Friday. Subsequently this week, because we're going into the New Year's week, there will be no testing, AMR, Wednesday, Thursday, Friday. Please make note of that. AMR is also expanding some testing. Commissioner Carlton Harris will speak of that to take some pressure off of our Springfield site. The monthly total is 3,760. And again, of note, there was no testing last Wednesday, Thursday, Friday, and there will be no testing this Wednesday, Thursday, Friday at Eastfield Mall area and subsequent areas that AMR is expanding to. Senior citizens, our home delivery meals continue, and I'm deeply appreciative of Commissioner Carlton Harris and Sandy Federico and the van pool service that we are doing there. Again, we urge you to get your flu shots, and flu shots have been extended. Superintendent will speak to you, Dan Warwick, on the school side, but we urge each and every one of you to get your flu shots. I got mine, and I'm doing fine. Again, the Governor Baker Stop the Spread continues. It's been expanded till March 31st. We thank AMR, they've been a great partner, and Patrick Leonardo. We're going to see what we can do to try to take some of the pressure off of Springfield. Everybody wants to seem to come to Springfield, and see what we can do, where we put our heads together on that. Again, there's no testing. Again, no testing this Wednesday, Thursday, and Friday. Vaccine updates, you'll be getting that from Dr. Kerouac and also Commissioner Helen Carlton Harris. If the federal government lives up to their guidelines or their word or their timetable, our first responders, such as police and fire, we're hopeful that very early in January that we'll be receiving the vaccines, if the federal government lives up to the deadlines and gets the full delivery here. And as I stated last week, lead by example, that I will get the vaccine shot when I'm eligible for it, and to lead by example to show that it is safe and sound for each and every one of you out there. Governor Baker, as you know, has done some reductions, some restrictions, kicking back to 25%. I spoke to him late last week, and again, this is for 2 weeks, trying to see if we can combat the surge that was happened during Thanksgiving, so we can combat any type of surge occurring for Christmas and the New Year's. But he's also, and Deputy Director Brian Connors, who is pinch hitting for Director Tim Sheehan today, will speak of, he's also backed up with $688 million in small business grants, and I believe it's up to $75,000 or 3 months of operations on that. So he has backed it up. I know it's a trying time for any and all of our businesses, and the city and state will continue to assist you. I'm very happy that the federal government, the president has signed off, so that COVID relief is starting to come. We need more of it, and I think, speaking with Congressman Neal, Chairman Neal, Ritchie, that more will be coming during the Biden administration, especially residents and businesses in city and state governments. We received an outstanding donation. I cannot say enough about the business community and our philanthropic community. MassCom Medical President John R. Chang, well over $200,000 in PPE supplies that were dropped off to us. I think Director Signoli indicated it must have been 26 pallets there at DPW, and myself and Commissioner Helen Carlton Harris and others that were here. We appreciate that. Joe Sullivan, who was a former mayor of Braintree, had reached out to me, and we appreciate that. And Mr. Chan has put out about nearly $1 million. In these supplies, there are supplies there he wanted to help out Bay State and Mercy, so we're going to try to help them out there too. But you're talking about masks, gowns, face shields, goggles, hand sanitizer, electrostatic spray guns, it goes on and on and on. So we'll continue to stockpile and also work with Commissioner Helen Carlton Harris pertaining to residents. But that was just outstanding. MassCom Medical, President John R. Chang from the eastern part of the state, and I appreciate the reach out. DPW, trash once again, and I'm on the Friday cycle too. Trash will not be picked up Friday, that's New Year's Day. Your Friday pickup will be Saturday, so make sure you put it out there either late Friday night or very, very early Saturday morning. We also, I understand that Governor Baker and MassDOT will be making some type of announcement today to continue to try to help our small businesses pertaining to dining type aspects, so we'll wait that. Oasis Food Bank, John Foley and Tedesco and team up at Central High School, great job, 3,500 families. Many last Wednesday. I assume they might be doing that again this Wednesday. As far as the police update, you'll be getting that from Deputy Chief Bill Cochran. They are down 17 dedicated men and women in blue, 17 down, and another 9 that are awaiting testing. 26 total down at the police department. We continue our discussions with DOJ and Judge Ireland. We had one late last week as we continue to move forward with initiatives and reforms. Deputy Chief Cochran indicates to me that the academy is okay. They are in session and they're doing okay. Wasn't a bad holiday week for police, though. We had a carjacking he'll get into on Alderman Street, 2 a.m., but they did great work to track these individuals down and to arrest them both from Alderman Street, Duggan Circle, using the dog also. They have now taken 200 guns off the streets of the city of Springfield. So great work, and hopefully our courts, by the police department, hopefully our courts will keep those individuals locked up. Commissioner Calvi's had a very, and his men and women have a very busy holiday week. On top of that, he's down 6 with COVID, 1 dispatcher, and he has 12 awaiting test results. Early this morning, he was on scene. He called me very early this morning. Terrible that somebody tried to burn down the Martin Luther King Presbyterian Church on Concord Terrace. It looks to be an arson type situation. We are reviewing cameras. Kudos to the fire department. The men got in there and were able to save some very valuable religious items in the church. And I've reached out to, through Ron Johnson, to the pastor there, and anything we can do to help them rebuild bigger, better, and stronger. But I hope that they get the culprit on that, and just terrible. Shame on that person to do something to such any church or house of worship. Just absolutely terrible. They also had a major fire in Pennsylvania Avenue, Oak Street, which was a arson, Brunswick Street, which was an intimidation one. They made quick work. Blue, they made an arrest on that one. So they've been kept very busy. Commissioner Calvi will go into it more, and Deputy Chief Cochran can go into it more on his report on police and fire side. DPW, the Director Signal indicates that he is down 3 with COVID. Again, we indicated with Friday's trash pickup will be on Saturday for the holiday week. Yard waste continues. They're going to continue to do it. They're nearly caught up, but they're going to do some wrap-up stuff. Christmas trees will start very shortly, 4 weeks of it. And again, you put your Christmas tree out during your recycling pickup. Superintendent Warwick indicates to me now we're well over 5 million meals served, 5,128,594 meals. 95,640 meals went out for the weekend. That includes breakfast, lunch, dinner, and snacks. Working with Pat Sullivan, Bob Kirshner, and Commissioner Helen Carlton-Harris, retrofitting continues in all our schools. The ventilation, matter of fact, Attorney Bill Mahoney, my HR Labor Director, mentioned, I think it was on NPR today, that they're putting more of an emphasis on ventilation than surface cleaning. We're going to continue to do both, but ventilation is the key to knock down this COVID-19. Superintendent will speak to you briefly on flu shots extended. He'll give you an update on the MCAS situation, winter sports. He indicates to me again that we are exceeding the learning time on DESE, which is good, so we're going above and beyond on that. Finance, my CAFO, TJ Plan, indicates to me since the start, lost revenue is $7.4 million. I'm down $2.57 million for FY21. The total in spending with deficits and grants, $18.4 million. Deficit okayed spending, $7.4 million. We're still awaiting to see a flexibility on the CARES Act money. We're hopeful that that can be carried over into the next year. Pat Sullivan, Parks and Facilities, he is down 6 with COVID. He continues with his team to work around the clock, retrofitting not only our school buildings, but our municipal buildings. Pat, and I appreciate that immensely. Pinch hitting for, again, Tim Sheehan and his Deputy Director, Brian Connors. He will speak more in-depthly on Governor Baker's economic development plan for small businesses. Brian did indicate, Deputy Director Connors did indicate to me, and I think it was last week, 18 businesses were on the first wave, Springfield businesses, and I think the average award was $30,000. But we want to make sure we can facilitate that more and more Springfield businesses take advantage of the governor's program. As I indicated before, City Solicitor Ed Pakula, we continue our conversations with Department of Justice, DOJ, and Judge Ireland on moving forward on reforms and initiatives with Commissioner Cheryl Clapprood. And Attorney Bill Mahoney indicates to me the unemployment rate in Springfield has gone down, still high, has gone down to 10.6 in November, down from 11.8 in October. With that, before I bring up Dr. Kerouac, I will read a statement. This is from Dr. Robert Roos of Mercy, Chief Medical Officer of Mercy Hospital, Trinity Healthcare, in which it states, "From us at Mercy Medical Center, we hope everyone enjoyed a peaceful and enjoyable Christmas, and we wish you all a safe and much brighter New Year. This year has clearly been one full of unique and dire challenges, but we are confident that if we continue we will unite our efforts in the name of public health and safety. We will emerge from this stronger, healthier, and more in tune with what matters most to our community." At Mercy Medical Center, the number of hospitalized patients has remained stable. Since the surge we saw post-Thanksgiving, we remain focused on the risk of second surge of patients that could result from gatherings amongst families for Christmas and New Year's. As of this morning, Mercy has 23 patients hospitalized with COVID, with just one in an intensive care unit. However, as our test positivity rate remains high at 10%, we continue to urge you to remain vigilant and modify or cancel any gatherings that may be considered for this week and next to help protect your health and our hospital's resources. In regards to our vaccination campaign, this is Dr. Roos now indicating, I am proud to say that we continue to vaccinate healthcare workers working at or affiliated with Mercy Medical Center and Trinity Healthcare. They have received, he says, we have received 975 doses of the Pfizer vaccine and 300 doses of the Moderna vaccine thus far, and we will have used up that supply in the very near future. So we are very eager to receive more from the Department of Public Health as soon as it is available. The campaign has been very successful, and the colleagues are enthusiastic to receive their vaccine. Again, this is Dr. Roos. I myself, Dr. Roos, received the first dose of the Pfizer vaccine last week with other members of the medical staff at Mercy, and truly feel grateful to be able to do my part to protect others in our community. I didn't feel anything but very mild soreness in my arm, and consider this vaccine truly our shot of hope to save lives. I encourage everyone to take this vaccine just as I have, and as soon as they are eligible. Again, this is coming from Dr. Roos. He indicates it is safe, it is effective, and our collective futures depend on it. We at Mercy will always continue to make priority your safety and well-being. Please do remain vigilant in and follow the life-saving precautions of masking, physical distancing, and staying safe to protect yourself, your loved ones, and all of those. And this is thank you from Dr. Robert Roos, the Chief Medical Officer of Mercy Medical Center. And speaking of the vaccine, Helen and I will announce as early as today that group we put together, trusted individuals, to get the word out that you need to take this vaccine as soon as you are eligible. So stay tuned for that. With that, I will now turn it over to the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Well, good morning, everybody. Happy holidays. Thank you, Mr. Mayor, for inviting me. Appreciate the opportunity and the opportunity to work with the members of your team. I want to give you now an update on COVID as it pertains to Bay State, but first just a perspective from outside our health system. The virus continues to spread rapidly throughout our communities across the country and across the world. Globally, we're at about 80 million cases with 1.76 million deaths. The United States went past 19 million cases with 332,000 deaths. The daily new case rate went back up. It had been below 200,000 a day, and it popped back up to 226,000 new cases yesterday. Many areas of the country are surging, including close to home, southern New Hampshire and Rhode Island. And we're about to finish what has been the deadliest month in the pandemic with 63,000 deaths in December. We are getting to the point, of course, where everybody knows somebody who's suffered with this virus. Massachusetts is now at 350,000 cases, over 12,000 deaths. Case rates are in the 3,000 to 4,000 a day range, with the 7-day average of deaths being around 50, and both of those numbers are on the rise. Hampden County is closing in on 25,000 cases, and the rate of new cases, that's 68 per 100,000 residents, places it number 5 in the state. Just to give you some sense of perspective, that is more than 10 times higher than the rate of new cases that we were seeing back in the summer, more than 10 times. The whole state is pretty much turned red to the point where they don't even issue the maps anymore. Hospitalizations across the state are at about 2,000, with over 400 in the ICU. I am hearing from my fellow CEOs in the eastern part of the state that they are nearing capacity, both in their regular med-surg beds and their ICU beds, something that we have not yet had to confront, but that we're quite concerned about. Excuse me. Bay State Health had come as low as 130 cases in the system last week. We've ticked back up to 150 as of this morning. 123 of those are at Bay State Medical Center, 27 are in our community hospitals, and 12 in critical care. The ability of our community hospitals to take on more of the COVID patients has been very helpful to us in monitoring our surge strategy. Our test positivity rate is 9%, close to Mercy's, close to the state's. We are maintaining enhanced testing capacity, both through our own reference lab up in Holyoke, as well as point-of-care devices in our hospitals, and send outs both to MIT and UMass Amherst. We're able to get to over 1,000. We're continuing to postpone elective surgeries and procedures that are done in the inpatient arena, when the delay of those will not harm the patient in the opinion of the provider. Even with that, we are still caring for hundreds of non-COVID patients, over 500 today at our Springfield campus, and it's just because those other diseases are not taking a vacation. We are also trying to keep the ambulatory care areas open as best we can to keep up certain important activities like cancer screening. We currently have plans in place to have another 150 beds of surge if we need it. Staffing continues to be an issue that we wrestle with, and I continue to worry that another doubling on top of our 150, in other words, getting us to 300, would really put the system at the edge. And I was concerned when I heard that yesterday was a record travel day across the country. Certainly in Western Mass, we historically have been more restrained than on average in the rest of the country, but it's still worrisome. On the vaccine front, the Moderna vaccine arrived at Bay State last week. We received 3,600 doses. We also received additional Pfizer doses. Remember, we had vaccinated 2,300 individuals with Pfizer and got the second doses for those people. But going forward, at least for the next few weeks, we expect to be using the Moderna vaccine exclusively. They're equally effective, and there is also data on reducing transmission as well as protecting the recipient from being infected. Our vaccine center is working quite well. Most days we vaccinate between 500 and 800 individuals. Since the inception of the program, we have sent out 6,200 email invitations. We have 12,000 employees at Bay State. About 20% of those have not yet been opened, and so our managers are contacting those individuals to make sure that they are scheduling to come in. We've had about 770 declinations of the 6,200 invitations. Over half of those I would consider to be of the soft variety, which is I want to wait till my friends have gotten it. And I think that is less than what many other systems are seeing. And I think it bodes well for efforts within the city. Remember, there are thousands and thousands of Bay State Health employees who live in Springfield and in all neighborhoods of the city, and the fact that we've been seeing low declinations in them as well may bode well for some of the work Commissioner Harris is going to be doing. We have administered in all, both Pfizer and Moderna, 3,500 doses. We will be at 7,500 either vaccinated or scheduled for vaccine by the end of the week. In terms of the side effects we're hearing about, we've seen some sore arms, some occasional flu-like symptoms, aches, pains, low-grade fever. There have been a handful of serious allergic reactions that required treatment, which has been provided at the site, and occasionally a patient who had a delayed reaction would go to an emergency room, but all were treated successfully using standard treatments. People have been very, very happy, very thankful to get the vaccine. They see it as a sign of hope and know that the vaccine is highly effective. We've been in regular communication with the state regarding folks outside of our employee base. It's been clear that the state intends to continue to follow the three-phase schedule that they published a couple of weeks ago. Phase 1 is for healthcare workers involved with COVID care. By the way, Phase 1 has an A, B, C, D, E, and maybe an F. So Phase 1 is healthcare workers involved with COVID care, followed by people in long-term care or assisted living, followed by first responders and people in congregate care situations, that would be prisons and shelters. We're waiting to hear the plan from the state on that. Don't know if we'll be involved or not, but the state is coming up with a plan that will be issued soon, I'm told within the next week or two. Following those groups, home health, and then healthcare workers who are not involved in COVID care, all of that is supposed to happen in January, possibly concluding sometime in early February. Phase 2, which would begin roughly in February, would include individuals with chronic diseases that put them at higher risk of a complication of COVID. Other essential workers, that would include grocery workers, education workers, utility workers, public works, et cetera. People who are elderly, over 65, or who have other chronic diseases, as I mentioned. That should begin in February, hopefully conclude in March. The general public, current estimates are in April. All of that, of course, is going to be affected by the availability of vaccine. I've gone on record to say I'm personally optimistic that the supply chain will hang in there and that we may even have additional sources of supply coming online in January or February. I continue to be very grateful to the frontline workers who have worked with incredible determination, dedication, compassion, including through the holidays. I'm grateful to those of you who decided to keep your celebrations small this year. It is, I think, the best way to express how much you care about your family and your friends. And I would appeal to all of you that we're almost there with this vaccine. It's just a few short months away. Please do the right thing. Wear your mask, keep your distance, wash your hands. Don't put yourself through COVID, putting your own life at risk as well as the life and health of people you care about. So I'll end there. Thank you again, Mr. Mayor, and happy holidays, happy New Year. We're all looking forward to a happier 2021, that's for sure.
I know that Audrey Russo is here from 40, Nick Oresco from 22. Matt, any questions now or comments for Dr. Kerouac so we can get back to his hospital?
Dr. Kerouac, there's been some concern about the pace of vaccination in the country at large, and it's hard to judge where you feel that the pace of vaccination is going within the case from the outside. How do you feel about where the pace of vaccination has been going relative to the availability of the vaccine? I read somewhere that only 1 million vaccinations have actually started, even though there's about 9 million doses that have been released for distribution.
Yeah, in terms of the allotment of vaccine at the federal or the state level, that's something that happens above my head. In terms of our being able to get the vaccine in arms as soon as we get it, I think that's been a terrific success story. We've used a email notification system. There is an app on smartphones, which 95% of people are using, that creates an appointment. and the ability to ramp up from absolute zero to giving, I think our record for a day is 760 people vaccinated in a single day, I think is quite a good story. So if we got more vaccine faster, we probably could get it into arms faster, but it's going pretty fast right now, I think.
Just as an observer of public health and the situation of the pandemic, are you concerned with the pace of the vaccination relative to supply statewide and nationally?
I wish there were more. I mean, if that's what you're saying, sure, I would love to have 20,000, in our freezers right now and be organizing to do, people beyond our own employee base, and starting with our colleagues who are first responders, including, our at-risk patients. I'd love to be scheduling those people already. But we have to deal with the reality that the vaccine is being allotted, in a sort of, so far, orderly way, but maybe not as fast as everyone would hope.
Audrey Russo, please.
With respect to the switch that you mentioned and using strictly the Moderna vaccine going forward, why the switch?
I'm not sure why they switched. I believe that the Pfizer vaccine, the future allocations of Pfizer were put into the pipeline for long-term care, seniors, and assisted living. And they handed them over to Walgreens and CVS, who were able to handle the cold supply chain issues. The Moderna vaccine is more numerous, it's more plentiful, it's a US-based company, and the amount of prepaid vaccine is there. I'm not sure why they made the switch. I've not spent a lot of time considering it, but we're happy for either one, quite frankly. I regard them as, they certainly are equivalent in terms of their effectiveness.
And just to follow up, because you mentioned CVS and Walgreens, I know that they're really scheduled for the long-term care facilities. Is there any sort of communication, I guess, between you guys and the CVS and local Walgreens that are going to be administering that vaccine in order to make sure that everybody is vaccinated in the correct way?
Yeah, the different streams of vaccination are being overseen by the Department of Public Health. We have not been in contact with CVS or Walgreens. I expect that when April rolls around, there will be many, many places to get vaccine. Quite frankly, that's the only way we're going to be able to do it for the remaining, 200 million people that need to get vaccine. But as of right now, we have not been coordinating with CVS and Walgreens because we really haven't had to. Now, that might not be true for certain health systems like Berkshire Health that owns skilled nursing facilities, but we're not involved in that.
Any other questions or comments?
Dr. Gerard, could you, at the end of this year, maybe obviously won't be out of numbers before the end of the year again, so I was just wondering if you could kind of give your assessment of how Western Massachusetts and Springfield specifically has weathered this crisis, particularly mindful of how it's gone elsewhere in the country and world, just to kind of give us some perspective on how we've been here.
I think that Massachusetts in general, and Western Massachusetts in particular, has been a model for consistency and coordination of message, leadership by our political leaders who have remained coordinated with the scientific evidence. We've not seen the political infighting about whether or not wearing masks is a red thing or a blue thing to do. And so I think that we've done an outstanding job, particularly since we were one of the first states to see this virus before it was broadly expected or appreciated that it could pass around before people had symptoms. With that said, I think that we could be doing better right now from the standpoint of COVID fatigue. I think there are a lot of people who are just going stir crazy and can't wait to get out of their house and start doing things, travel and see friends and hang out like they used to. And it's been very hard for us to get the message to stick in enough individuals' minds that this is still a dangerous situation and we need to be careful with it. So I think we've done better than nearly any other state in the country that I can think of, and better than most countries, not all, but we're not doing as well now as we were several months ago because I think the fatigue factor is setting in.
Any other questions or comments? Dr. Kerouac, thank you, and to you and
My
your
pleasure.
team. Good
Yeah.
health and
Happy New Year's. Yeah.
Thank you again, Dr. Kerouac. I forgot to give you, before I bring Helen up, an update on people who have lost their lives to COVID-19. The number stays the same. We know that, unfortunately, others have passed, but that hasn't been confirmed yet. And speaking with Commissioner Carlton Harris earlier this morning, but the numbers as of right now, until we get other confirmed cases, and again, thoughts and prayers and sympathy and encouragement go out to each and every one that has lost a family member or close friend to COVID-19. Springfield residents, 150 have passed away. That will change. We only update it when we get confirmed cases. We know, unfortunately, others have passed. 64 white, that's 42.9%. 33 black, that's 21.8%. Hispanic is 49, which is 32.6%. Asian is 4, which is 2.7%. Long-term care facilities, 58 have passed there. Residential, 92. With that, I will now bring up the Commissioner of Health and Human Services, City of Springfield, Helen Carlton Harris.
Good morning, and thank you, Mayor.
Thank you.
We are going to begin with the data. I'm going to start with the line graph that speaks to the low month and this month, which is the high month. In August of 2020, there was 182 cases in the city of Springfield for the entire week. This week, in December, the month of December, so far we have seen 3,760 cases. That is up from the 2,667 cases that we saw in November. The surge continues. We continue to see cases in the city on a very high level. And so let's take a look at the week of December 6th. We had 1,033 cases. That did go down the week of December 13th, which is 957 cases. And this week, the week of December 20th, we are at 866 cases. If we look at the 3-week average, I'm just going to go to this week, which is the gray bar. On Sunday, there were 149 cases. On Monday, there were 142 cases. On Tuesday, there were 90 cases. On Wednesday, there was 151 cases. On Thursday, 186 cases. And on Friday, which was Christmas, the Commonwealth did not do reporting on that day, but we did pick up in our Maven system 11 cases on that day. The next day, Saturday, was 137 cases. I want to remind you that the cases in Maven lag a day behind, and so we are reporting to you statistically the last date we have complete data, which is Saturday. Looking at the ages of the cases, 0 to 10, 78 cases, 11 to 20, 132 cases, 21 to 30, 168 cases, 31 to 40, 132 cases, 41 to 50, 131 cases, 51 to 60, 114 cases, 61 to 70, 69 cases, 71 to 80, 27 cases, 81 to 90, 11 cases, and 91 to 100 is 4 cases. The percentages as far as age groups are concerned, 30 and under, 44% of our cases, 31 to 50, 30% of our cases, and 51 and older, 26% of our cases. That still indicates that the majority of our cases, 74%, is under the age of 50. Our zip codes, where we're seeing cases in every zip code, 01109 is reporting 4 cases. 01103, 1% of the cases, that's 9. 01104 is 18% of the cases, 154. 01105 is 7% of the cases, that is 58. 01107, 9%, 79 cases. 01108, 23%, 196 cases. 01109, 169, 20% of the cases. 01118, 79 cases, which is 9%. 01119 is 5% of the cases, 47 cases. 01128 is 11 cases, which is 1%. 01129, 29 cases, which is 4%, and 01151, 31 cases, which is 4%. The race breakdown, again, the unknown is a large portion that we are concerned about, but again, when it says unknown on our sheets that we receive, then that's what we put down. African American, Black at this point is 15% of the cases reported. Asian, 3% of the cases. Alaskan Native, 1%. Latinx, 22%. White is 35% of the cases. The total confirmed cases in the Commonwealth of Massachusetts, Dr. Kerouac has told you, is 335,731. Again, my data is as of Saturday. That is an increase of 28,803 cases from last week. The total deaths in Massachusetts, 11,732. That is an increase of 347. And I should remind us that just yesterday, one day, there were 100 deaths in the Commonwealth of Massachusetts. That is the largest number of deaths that I've seen in any one day, up from the 89, which was the highest reported number. Again, 100 deaths yesterday in the city of in the Commonwealth of Massachusetts. The total cases in Hampden County, 24,666. We increased by 2,241. The total deaths in Hampden County, 1,028, 34 deaths increased. The city of Springfield, the mayor has told you, we have 10,586 cases, an increase of 866. The deaths in the city of Springfield remain at 150. That is going to change. We just have not had the ability to look in our database to update that number. I expect next week we will be providing a larger number. The average age of deaths in the Commonwealth was 80. That was down from 81 that I reported last week. And the average age of hospitalizations is 69. Last week, that average was 67. So the age of individuals being hospitalized increased, and the age of individuals dying decreased a bit. Stop the spread testing, again, we're thankful to AMR. It has been reported that they will not be testing on Wednesday, Thursday, and Friday, but to date they have tested 91,117 individuals. They've had positives of 7,311. Springfield residents, 37,458. They have tested at the Jewish Community Center. This is a part of Stop the Spread. They have tested at Friends of the Homeless and are testing weekly at Holyoke Soldiers Home. So Stop the Spread has had some expansion to very specific groups and populations. We are continuing to do our case investigation, contact tracing. Again, as always, when the contact tracer calls, please answer that call and respond. It is not to blame or to stigmatize, but rather to understand who you've come in contact with over a period of time so that we can stop the spread and mitigate the impact of this virus. You heard the hospital update. Our hospitals are definitely seeing the surge. They have been containing that number for the most part over the last couple of weeks, but it is concerning as we move into the New Year holiday. We anticipate that there will be a surge on top of a surge, and so we are asking once again for your vigilance, for your patience, and for you to please follow the public health strategies that have been outlined. In the beginning, there was an outpouring of support for our first responders, especially our first-line healthcare workers. We want to make sure that we continue to lift up those individuals who are on the front line, who are doing COVID-facing work. They are heroes, they are working every day, and they are tired, and they're watching their numbers go up, they're watching their own families become a part of the surge. And so I want us to always keep in mind those first responders who are working every day to support us. Bay State Health, Mercy Medical Center, Trinity Health in this area, as well as private doctors' offices, are doing everything they can to help us get through this. But I particularly want to be us to be vigilant and be concerned about the individuals whose lives we are putting at risk, those frontline workers when we go into the hospital potentially and are needing to be cared for. The other parts of their job that they're doing is compassionate care because relatives cannot go in. It is those hospital workers who are holding the hands, who are brushing the hair, who are kneeling with individuals as they pray. And so, again, I want to just make sure we're thanking them and keeping them at our forethoughts. We give you this information so that you can have access to appropriate, accurate, and timely information in accordance with regulations and guidance. And we do this because we'd like you to take our advice and do what we are asking to mitigate and contain this virus. The vaccines are here. We know that vaccines are being distributed, but we also know it's going to take potentially another 6 months for us to have the level of herd immunity that individuals are asking that we have in order to really make sure we can somewhat return to some faction of being normal in our lives and in our behavior and with our families. So when the individuals from the contact tracers call, remember to isolate. That involves the sick person. If you've tested positive, you should be isolating. Those individuals around you who potentially are exposed are asked to quarantine. We have continued to maintain the 14-day quarantine, even though the CDC has backed to 8 to 10 days. The concern is that the guidance continues to change, and I believe all of us want to make sure that we're consistent with those individuals that we work with. We understand that it's important that individuals behave in a way, again, and I will say it over and over again, we must mitigate this virus to the degree we can until we have achieved herd immunity. The mayor will be announcing a team that we are calling VaxForce. The VaxForce individuals and committee members will provide credible concrete COVID-19 resources to the citizens of Springfield using science, data, and information to guide decision-making. Again, I anticipate the mayor will put out that press release later on today with the names of the individuals and the goal of the of VaxForce, which again is to provide information to our residents that is credible, concrete, so that we can help individuals make good decisions around vaccine hesitancy versus vaccine acceptance. Effective December 13th, the governor put out outdoor gatherings are limited to no more than 50. Hosts of outdoor gatherings greater than 25 people will be required to provide advance notice to the local Board of Health. So if you are having an outdoor event of 25 individuals or more, you must notify the Springfield Department of Health and Human Services, which is the Board of Health. Indoor theaters and performance venues and high-contact indoor recreation businesses will be required to close to the public. Outdoor theaters and performance venues will be limited to 25%. And the capacity of no more than 50. In offices, and I think this is very important, employees must wear masks at their place of work when not in their own workplace or alone. And so, in addition, patrons of gyms must wear masks at all times. And I know that's difficult when you're working out or when you're on a machine, but it's important also to remind individuals in areas and venues that masks should be worn at all times. Again, our behavior must be as if everyone we meet has COVID-19. That is how we must live our lives right now. The federal government has a role in the distribution of the vaccine and to give us all credible information. The state government has a role in distribution and information, and local government has a role. And the city of Springfield continues to work with those individuals in our neighborhood councils as well as our businesses to try to give information and try to help everyone understand the seriousness of this virus and what each of us must do. So as local government, we understand we have a role, and that's why the mayor will be announcing the VaxForce team in order to solidify our role as far as vaccine is concerned, but also to continue to make sure that we are giving the information necessary. And each of us has a role, and I think we know that. We talk a lot about the power that each person has to stem the tide of this virus, but that is so true. Dr. Kerouac mentioned we're all concerned about the number of individuals that are that traveled over Christmas and are traveling over the holidays as we approach the new year. And so we continue to ask social distancing, physical separation, wash your hands frequently, stay home if you're sick, wear a face covering in public, stay home, stay safe. That is our goal. The loss of loved ones has been something that has taken a toll on each and every one of us because it's difficult to look around and see that there are individuals last year who were with us, who were dancing with us and hugging us, are no longer with us. And then we can't be with our families in the way that we would like to. But 2021 is a year that we are all looking forward to when we can get back to behaving in a way that is somewhat normal, and you'll hear that over and over again. And the first to end for me, I think about the first African-American woman to win a Pulitzer Prize in poetry, and what she said is, "We are each other's harvest. We are each other's magnitude and bond. You and I are the leaders, the healers, and the teachers we have been waiting for." And that's simply to say no one is going to save us but us. The power to be able to make decisions around what we must do from a public health perspective belongs to us. And I ask you, as we approach the new year, to think about that power and think about those around you that you want to move into 2021 as healthy and happy and wholesome and getting our children back into the classroom. All of that depends on our behavior. And so in ending, I want to thank you. I want to say thank you to those first-line workers who are in the hospitals and in the grocery stores and in the buses, and everyone who is really just putting themselves at risk in order to make sure that we're maintaining some services that are essential. I want to thank the individuals at the Springfield Department of Health and Human Services for their support and for their hard work. I want to thank the staff and the residents of the agencies and organizations that we work with. Obviously, the mayor, the cabinet team. It's been a road that we're all traveling on this journey together, and we're just really hopeful that there is light, and we know there is light at the end of the journey, and that we get there together. That's the goal. Thank you.
Thank you, Commissioner Helen Colton-Harris, our Dr. Anthony Fauci. And speaking of heroes, now we'll go into the public safety component update, and we'll first start with the Commissioner of the Springfield Fire Department, Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. To start today with the COVID front, we have 6 firefighters who are positive for COVID-19. We have 1 dispatcher positive for COVID-19, and we have 12 firefighters awaiting testing due to close exposure or close contact with someone who had COVID-19. We've been busy for the last 4 days at the Springfield Fire Department. I'll start with the Pennsylvania Avenue fire on Christmas Eve. That fire went to 2 alarms. We had 1 firefighter who was severely injured with non-life-threatening injuries. He was transported to the Brigham and Women's Hospital for burns. He's since been released and undergoing further evaluation. After that, we had an arson fire at Oak Street, which is currently under investigation, and then we had a threat to burn intimidation case on Brunswick Street, which an arrest was made by the Arson and Bomb Squad in the Springfield Police Department due to some heads-up work by the squad unit that was on duty in that area, saw the person leaving the area, made a traffic stop. We sent the arson team over there with a detection dog, and arrest was made on that. Brings me to the next fire, which was this morning at 5 a.m. at Concord Street, the Martin Luther King Presbyterian Church. Had a fire at it this morning. There have been several nuisance fires in that neighborhood that we've been looking into. This morning's fire is highly suspicious. Currently, the Springfield Arson and Bomb Squad are on scene investigating with the Mass State Police, fire marshals, and alcohol, tobacco, and firearms. And I was just notified from the scene that the FBI is currently involved in the investigation as well. I'm going to give you a phone number, 1-800-682-9229. That is the arson hotline. Any call to that line can be anonymous. There is a $5,000 reward for information that would lead to an arrest in this case. After this, we'll also be having a press release with the text-to-tip line for the Springfield Police Department and with this phone number to follow up. These fires place not only the citizens but the firefighters in jeopardy. Arson fires spread very quickly, they cause a lot of damage, and they are needless. The Alcohol, Tobacco, and Firearms FBI, the state police, as well as the Springfield Police Department and the Arson and Bomb Squad are investigating this. We are looking for any and all leads that can be used in this fire, and we're taking this matter very seriously. We were able to save some of the religious artifacts from the church this morning, but the inside of the church is totally destroyed from this fire. So this was needless. It looks to be needless, and it's inexcusable. That's all I have this morning.
With all these fires, especially the arson fire, and especially with a house of worship such as Martin Luther King Presbyterian Church, this will be pursued to the fullest extent with federal, state, and local public safety officials. And shame on the person that did this. You will be caught, you will be prosecuted, and a message will be sent. No one, whether a home or a house of worship, at any time, but especially during the holiday season, perpetuate this type of hideous crime. So they're going to hunt you down and they're going to get you. And you're going to face that full extent of prosecution. Speaking of that, we'll now bring up Deputy Police Chief Bill Cochran of the Springfield Police Department. He will give an update pertaining to police activities. Deputy Cochran.
Thank you, Mayor. Good morning, everyone. Currently, we have 17 officers in the police department that are out that tested positive for COVID. We have 9 other officers that are awaiting testing as they're being exposed to COVID. As Commissioner Calvi already talked about, the highlight of the last few days obviously was the fire this morning at 5:06 a.m. when we responded to 14 Concord Street. Other than that, on the 24th, we had a carjacking, which happened at about 2 o'clock in the morning. A woman was getting into her car on Alderman Street when she was approached by 2 men masked and brandishing firearms. They threatened her, took her car keys, and drove off with her car. A couple hours later, officers saw the car operating in the vicinity of Bradley Road. They gave chase but weren't able to stop the car. Short time later, the car was located, parked, abandoned on Dungan Circle. Inside the car, officers located a realistic-looking pellet gun on the floor. Officers then set up a perimeter and brought in the K-9 unit to perform a track. The track eventually located one of the subjects who was still in possession of a loaded .22 caliber firearm. He was placed under arrest without incident. The other subject was arrested by officers a short distance away and was also placed under arrest without incident. As the mayor said, this marks the 200th illegal firearm recovery this year by officers during an arrest. On a lighter note, Bright Nights has been pretty busy for us, and we've been able to manage all the traffic congestion on the Sumner Avenue and the adjoining neighborhoods. And we thank all the motorists for their cooperation during this time, and that's all I have, Mayor.
Thank you, Chief. Thank you, Deputy Chief Cochran. Great work from our dedicated and brave men and women in blue on that arrest. And BJ, to Commissioner Calvi, again, to your men. And again, I wish good health and speedy recovery to that firefighter that with that burn situation for he and his family. We'll now get an update pertaining to our schools and the Superintendent of Springfield Public Schools, Dan Warwick.
Thank you, Mayor. Good morning, everyone. An update on our meals program. We provided families with 95,640 meals over the weekend, and we're up to a total of 5,128,594 since school closed back in March. So very, very proud of our team for their great work on this issue since school closed. A Sodexo team that works with a team at the school department. This week, Monday and Wednesday, we're going to distribute and again take families right through the weekend. So the Wednesday distribution will take them through the weekend. School committee took a school reopening vote at their last meeting, and they've voted to reopen schools at the beginning of the fourth quarter, which is April 9th, with an opportunity for us to open for some specialized groups before that, working closely with the school committee. And those groups could be like vocational students at Putnam Vocational High School for their vocational shops, our high-needs special ed students, and our SLIFE students, our students in the ELL program that had huge gaps in their learning before they came to Springfield Public Schools. I just wanted to say thank you again to the Eastman Company. They donated $5,000 instead of having Christmas parties, and we were able to provide 100 families with $50 gift certificates to Big Y over the holidays to get them through the holidays. They've been a great corporate citizen here in Springfield. Wanted to call out Pat Sullivan and Bob Kirshner and the mayor on the work with O'Reilly, Talbot, and Oaken, spending millions of dollars on our ventilation systems in our schools. And that work is coming along very, very well. And we have a plan to have all that work done in March. So when we reopen, we'll maximize student safety, which is a big concern in the city. When we surveyed our parents and got feedback during that town hall meeting, it was very, very clear that 75% of our parents were reluctant to send their kids back to school. So I think that, given the surge and the fact that we really should fix the ventilation system. So very, very grateful to the city and all their support with that, and very grateful to the mayor because that hasn't happened throughout the Commonwealth. And all of that, of course, was done not using the school department budget. We haven't had to lay off any employees since this pandemic began. Flu shots, still pushing families to get those flu shots. They have been given an extension till the end of February to get the shots done, but it's a good time to get those flu shots done, and they are going to need them when kids come back into school in March or April. MCAS test, there still has been no final decision on MCAS, but there's a lot of discussion in the Commonwealth about canceling MCAS this year, and there is no point to giving a test for accountability purposes during a pandemic, so we're hoping the commissioner moves along in that direction. Winter sports, a reminder, they are going to start January 11th, and with the support of our health commissioner, Helen Calton Harris, we're going to have all of the students who want to participate tested before January 11th, so we know it's safe, and we're going to have 3 tests during the season to make sure, again, it's safe. And what we're going to be offering is basketball and swimming, and wrestling is going to be held in the spring. So right now, it still looks like we're on for January 11th for our practices to start. Department of Elementary and Secondary Education issued a student learning time, new regulations throughout the city, and asked for a submission from every district as to what we're doing. And our plan exceeds the regulations, so our students are getting beyond what they need to get for student learning time. So very proud of my staff and their great work on that. Happy holidays to everyone. Thank you, Mayor.
Thank you, Superintendent Warren. We'll now go an update from the Department of Public Works and Director of Department of Public Works, Chris Signoli.
Mayor, thank you. The DPW right now has 1 employee out due to COVID, 2 other employees out awaiting tests. As the mayor mentioned, trash this Friday will be moved to Saturday. We will be putting out a notice this week for 3 items. Number 1, that the trash is moving to Saturday. Number 2, that yard waste will be finishing up this week. We are very, very much caught up over the last 10 days, and we'll be making 1 run through the city this week to catch up on it. And we will be picking up Christmas trees. Have to double check with our vendor to see if we will be starting next Monday or the Monday after, and we will be doing it for 4 weeks. So you will have 2 cycles at your home for your recycle week to get Christmas trees picked up. And lastly, as the mayor mentioned, we had a huge donation from MassCon Medical Supply last week. Gowns, goggles, face shields, hand sanitizer, wipes, etc., that are really, really needed in this city. And Helen's group and Pat with facilities will be working with me on the distribution of those to different agencies in the city and to different groups with that. But a huge donation and a huge thank you to that group. That is it, Mayor. Thank you.
Thank you, Director Signoli. We'll now get an update on facilities and parks from Director Patrick Sullivan.
Thank you, Mayor. We have currently 6 employees out with COVID. We continue to work with Eversource on electrical solutions for the 4 schools that will have the carrier OptiWave units. We're down to engineering the Homer Street School, and we are coming up with a couple of options, so all 4 buildings will be covered with the carrier OptiWave units. Our trades force continues to install the iWaves in our remaining schools. They should be in the final stages with our fire stations this week, and they finished the police department last week. We're very appreciative of the significant donation from MassCon that Director Signoli just mentioned, and this will be great to match with our supplies and materials that we're getting through under the CARES Act. We're working with the Finance Department and our Health Department on those supplies. And all these materials are very important as Helen gets everyone vaccinated and we can return to our normal operation. We will still need to follow the CDC guidelines under COVID over the next year. And I just want to thank the public for continuing to schedule appointments. I know it's cumbersome, but it's very important that we stay with this for the next few months as we deal with COVID. Thank you.
Thanks, Pat. Thank you, Director Sullivan. So I always say Springfield's in the business of doing business, and Deputy Director Brian Connors is here, pinch hitting for Director Tim Sheehan. Brian and team have done a great job of getting millions of dollars out to our businesses. He's going to give you some more information from the state to any and all of our businesses here in the city of Springfield. Please adhere to his message, because we want to help you not only survive, but stabilize and thrive. Deputy Director, Economic Development, Brian Connors.
Thank you, Mayor. Just a couple of things. We are keeping an eye on the COVID relief package that the President signed last night, which includes $284 billion directed to business assistance, which will reauthorize the Paycheck Protection Program. Important for us, it expands it to nonprofit organizations. We have many nonprofit organizations in the city that provide great services, but also employ many Springfield residents. So that should be an excellent advantage. It also includes $15 billion for Save Our Stages to help performance venues, and $25 billion for emergency rental assistance. So as those programs become available, we'll certainly keep you updated. As the mayor indicated, the state made a couple of announcements last week that we want to emphasize to businesses. They announced the first round of awards for their business relief program, $49 million in grants for 1,100 plus businesses. We had 18 Springfield businesses be awarded, totaling $655,000 for an average grant of $38,389. The state has authorized $668 million additionally into that program. So they're expecting to announce more awards from the first round, so potentially more Springfield businesses will get awarded, and they're opening up a new application round. So we want to encourage Springfield businesses to go to empoweringsmallbusiness.org. That's empoweringsmallbusiness.org. The application period will open up later this week. They're supposed to be uploading details as soon as today to that website on who's eligible, how to apply, but it'll all be done through the website. We'll have that on the city website as well if you have any questions. Thank you.
Thank you, Brian. Thank you, Deputy Director Connors. Again, you received a financial update from my Chief Administrative Officer, TJ Plant, legal update from Ed Pacula, which I gave you, and HR, Labor, from Attorney Bill Mahoney, which I appreciate on that. So with that, we'll open it up to any questions or comments you might have of cabinet heads and or myself, if any. Okay, thank you very much. And I would, go ahead, Audrey.
Sorry, usually I talk first. I was going to let somebody else talk first.
That's okay, Audrey, go ahead.
I just have a couple questions for now.
Sure. Commissioner Colton-Harris?
There you are.
I just wanted to ask about, you mentioned that we're still in the surge, I guess, and you could say to people as we head into New Year's, post-Christmas, just concerned about the surge in cases.
Yeah, I think the message for me is extremely clear. Smaller is better, and to stay in your immediate bubble. So those individuals that you live with are safe in your bubble, and so we would appreciate it if the gatherings are limited. We are still seeing the surge in small gatherings, and so we'd like individuals to please keep your gatherings small, keep them to your household, help us prevent the surge on top of the surge that we are expecting.
And I know that Dr. Carraway mentioned the vaccination of long-term care facilities really being overseen by state health officials, but I guess your guys' role in, if there is any, is making sure that those vaccines are given out in a timely fashion.
Yes, the local boards of health are collaborating with the State Department of Public Health right now. I know that our role will be to vaccinate first responders. We are anticipating, as the mayor said, the first vaccines to come in the first or second week of January, given that the federal government keeps to its timeline, and then we will begin the process of arranging to have our first responders vaccinated. The state has asked us for the numbers that we anticipate. We have given them some numbers. We will be increasing those numbers just to make sure that we have enough vaccine to vaccinate all of our first responders who want to be immunized.
Helen, just a quick question for you. You mentioned a couple of weeks ago that the Board of Health, boards of health are trimming for like mass vaccinations. And I realize that's further down the way for this, but I know that there's been some concern in some states, because a lot of states have this process of mass vaccinations on the local community health level. Some states have kind of been pulling back from this in their early planning. Is that still something you expect to happen based on what you're hearing from the state, assuming vaccine availability becomes widespread?
There is concern about vaccine distribution. There is no doubt. I mean, we are absolutely not accustomed to doing vaccinations on this scale and needing to do it in 2 stages. However, we do have emergency dispensing sites. We have looked around the city, or we have created a plan that we've had in place for years, knowing that we may potentially have to do mass vaccination. Also, remember, the city of Springfield was doing flu shots for 300, 400 individuals. So we are accustomed to a large vaccination clinic. However, needing to do it in 2 stages, making sure that we're notifying everyone to come back, and everyone does come back to get the second shot is something that's going to be new to us. And so I think all of us at the local level are concerned and want to make sure that we have the infrastructure in place to be successful, because it's important that we get this as right as possible. We want to make sure that we're ready.
And there's no sign yet that the state is not planning to utilize that capacity on a municipal level. You still are expecting that when vaccine is available and logistical issues notwithstanding, that plan will be executed.
The state DPH has contacted us as late as last evening to give us instructions about the potential number of vaccine and how we are we still prepared to move forward. The city of Springfield has said that we will be a part of the vaccination process. We believe working with our partners will have the capacity to do the necessary numbers. And so, yes, I am clear that we will be involved. We have received confirmation. We have not, however, we don't know the numbers of vaccine at this point, and I am not releasing the site that we will use at this point.
We're going to stay flexible, Matt, as we have with our testing, where we've taken advantage of state and federal resources and run our own on a local level. But as we, cabinet heads, interdepartments will have to work together, because when the site and/or sites are listed There's a myriad of departments that have to be involved, from traffic, to public safety, to health, obviously, to communications. So we're going to do everything and anything we can on continued expansion, not only testing, but when the vaccine really becomes full-fledged, to get it out there. And Helen and her team and the rest of the team, again, I'm very proud of the cabinet heads down the rank and file. I always say they've been tested and true through a number of natural and man-made disasters. But please heed Helen's advice and Dr. Kerouac's advice about small gatherings, only people you've been with. I've spoken to some people, friends and relatives, who now have tested, they said they've tested positive. They didn't think in their wildest dreams it would happen to them. And that's why you really have to only be around people that you have been around. It's difficult to do, your loved one, family members, close friends. But I think it's been eye-opening to some people, younger people, who thought they were immune to it. So we're going into New Year's now, and it is just imperative that very low-scaled, tight get-togethers of people that you have been with. We've all had to do it. I need you to continue to do it. Commissioner Carlton-Harris and Dr. Kerouac, Dr. Ruse indicate you really don't see the surge number until 10 days to 2 weeks after these types of holidays. And again, the governor has put a 2-week pause to try to hinder any type of massive surge. We continue to coordinate and work closely with Bay State and Mercy to make sure that on their capacity levels. So you have to stay vigilant, even though the vaccine is here and it is coming. And we hope that the federal government continues to get the numbers that need to be here in Massachusetts, and in turn, when it gets to the state, to get down here to the city of Springfield as soon as possible. With that, I want to thank the media again, TV, radio, print, for continuing to be diligent about getting this information out. I want to thank each and every one of you, the residents and the business community of the city of Springfield. I know it's been an arduous task that we've had to do, but your patience, your understanding, and your collaboration is deeply appreciated. We still need to continue to do the two-pronged approach, following all the guidelines of masking, washing your hands, social or physical distancing. If you don't feel good, stay home. And in tune, the vaccine is here and it is coming. So out with 2020, which has just been absolutely a terrible year. And here's to a good 2021 of good health and success and a quick rebound to keep the momentum going here in the city of Springfield, to you and to your families. Happy New Year, good health, and God bless. Thank you very much.